let me welcome you all to this panel. It will be the closing plenary of the conference this year. We are thrilled and excited that it is the International Year of the Nurse and the Midwife. These are two primary care, incredibly diverse and international professions. We are very excited to hear your perspectives on how nursing and midwifery are contributing to health objectives, population health objectives, and sustainable development goals. And I was wondering if we could open the dialogue by talking about your professions and how nurses and midwives are adapting to pandemic environments and population health imperatives in this in our situation currently. I would love to hear your experiences, some of the projects that you may be involved with, and how your professions are taking steps to broaden and empower the populations you serve.
I would say that midwifery is certainly adapting to the pandemic and trying to respond to how the coronavirus is affecting reproductive health and newborn health during pregnancy, birth, and postpartum. So I think we're still learning about how the coronavirus pandemic is affecting perinatal health and the populations we care for during pregnancy, birth, and postpartum here in Canada. And so part of what we're seeing is, disruptions to routine care with changes to telemedicine. Birth is looking very different with only one support person and a lot of PPE. Restrictive local birth protocols are being put in place that are not necessarily evidence-based, that are increasing interventions and C-sections. We also see a reluctance of pregnant people to use or access the healthcare system. We're seeing reduced access to contraception, abortion access. We're concerned about breastfeeding practices and how those are being impacted. And I think in general, the product of being isolated has increased gender-based violence and exacerbated mental health. And so what we're seeing is our midwives mobilize during the pandemic. And so the beauty of midwifery is the recognition at this point in time of our ability to provide primary care in a number of settings. And so this has been a strength that's been demonstrated as health systems become overwhelmed. Midwives are able and being sought after to lead out of hospital birth practices and services. We're seeing coordination between ministries of health along with midwifery associations to create these alternate birth pathways to ensure that birth services will continue in a safe way during the pandemic. I think a big part of the work that we've been doing is ensuring that perinatal services are considered an essential service during the pandemic. And so we've been able to gather all perinatal health associations and are in the process at the moment of creating supportive guidance on the provincial, but also federal pandemic planning for reproductive services in urban, rural, and remote regions, really inviting all health practitioners to look at ourselves from a multidisciplinary perspective, but looking at what are our contributions to public health and where can we mobilize in this pandemic when public health is focused on contact tracing, is focused on so many other things. And so as midwives, what we've seen is this can look very different from place to place, but in Quebec, midwives have been assisting obstetricians and general practitioners in doing the follow-up care in the community. So ensuring breastfeeding, mental health, wellness teachings. In other areas and jurisdictions, it's been mobilizing midwives, to provide increased access to vaccination care regarding influenza vaccine distribution. And so we're seeing the midwifery profession sort of step out of its usual boundaries to sort of provide services where it's within our capacity and scope, and support sort of ongoing service delivery. And probably I would say the key aspect is that I think that other care providers are really recognizing that the fact that we do work in the community really means an increased access to service and increased access to public health services. So there's been, great collaboration in those spaces. I think for Indigenous communities, the pandemic's really heightened the importance of building the local structures and systems to integrate reproductive care at the local level. And so part of the work that is ongoing and that we've been doing with the National Aboriginal Council of Midwives has been removing the barriers to midwifery education, creating alternate pathways to grow Indigenous midwifery, and ensuring how can we bring birth closer to home and have those capacities within communities.
Aga Khan Development Network nurses work in the continuum of care for the communities we work in. And starting from promotion, health promotion, to prevention, to therapeutics, to rehab, we are there. To nursing academics and nursing research, we are there. And when it came to COVID, being a novel virus, it was so new for us, and we as nursing fraternity had to understand not just the disease, but the importance of ensuring that we are going to our clients, our communities, and our patients and provide them with the safe care. One of the interesting, innovative things I think AKDN nurses did was to really immediately accept and adapt to the health informatics, and using the innovative ways of apps and cellular phones, and going to our patients and our communities in the mountainous areas of Afghanistan and northern Pakistan, to Kenya and Tanzania. Going to the communities in the safest possible way, we also had to aim to ensure that we provide safe care to our patients in the hospitals. And as you know, every day was a new thing coming out with COVID and its treatment. And one of the important things which we learned in AKDA nursing and AKDA healthcare system was that COVID made us to open up our silos and work in a multidisciplinary manner. And that's what we achieved to ensure we have the appropriate clinical protocols for our nurses, our midwives, our doctors, and others, to ensure that we are keeping our patients safe as well as our staff safe, because COVID was both community acquired as well as hospital acquired infection, and sort of a double whammy for our nurses. Also important aspect, which I think we really embraced immediately, was to strengthen the public-private partnership. It was important that we work with the governments we were interacting with, to learn from them and also to share our experiences. So I think some of these exciting, innovative things which we did to ensure that we get to our patients, our populations, and also keep ourselves safe as nurses and as practitioners.
So just to echo my colleagues, we've seen a huge push towards the inclusion of interdisciplinary and multidisciplinary healthcare providers and healthcare workers within various fields to combat this pandemic. And I think that it's been interesting to see that shift because it's long needed. We're seeing nurses and midwives take up positions within leadership, within policy advision, within consultancies. And it's this non-conventional norm now, where you're not seeing the classic clinical role of the nurse. You're not seeing that classic scrubbed in role of the nurse, but rather we sit at policy tables, we sit at consultancy tables, we advise different practices and different protocols. We're leading the public health workforce in the way that we're combating this pandemic. And I think that's something that's incredible to see how rapidly that shift has taken place and to see the momentum it's gained, especially being the year of the nurse and the midwife, and how that's really encouraged this movement and perpetuated it. And it's something that I hope we can maintain coming out of this pandemic as well, is this momentum and this vested interest within the multidisciplinary fields of health. It's not necessarily the doctors and the expert practitioners leading the pandemic movement, but rather on the ground clinicians who have been trained in various fields, who have different roles and different credibilities, and bring about these experiences that influence the way that we're able to combat this. And I think that that's something which is amazing. And again, just maintaining that coming out of this would be really superb, but I'd like to see how that's going to function in a post-pandemic world. And to couple with that, it's the inclusion of younger nurses and earlier career nurses. I think we're leaning towards that shift a lot more so now than before. When this pandemic hit, we noticed that a lot of the younger nurses, a lot of the younger midwives, a lot of the younger interdisciplinary career professionals and early career professionals, they were really stepping forward and saying, hey, listen, we're gonna help combat this. We're gonna do what we can to be active in this movement because we've been trained and this is what we're prepared to do. And it's nice because you're getting that credibility really given to us at this point, and we feel like we are valued. And we're seeing that career momentum and that early career push within the first 5 years. So that's really interesting. And I think that it's cool to see in this situation. It's a tough situation to be dealing with. It's an unfortunate situation that we're in, but it's neat to see the momentum that it's driven with that early career standpoint and with these interdisciplinary workers.